Hello everyone, this is Professor Lee of Dr. Wild of TV. Antidiabetic effect has been clinically proven among the world's top 10. Three medicinal plants in part 1 lecture, I introduced cinnamon, fenugreek, and garlic. In today's second lecture, from number 4 to 7, I'm going to introduce 4 medicinal plants. The order of introduction is, it has nothing to do with the ranking of effects. Let's begin. It is the fourth medicinal plant. Belonging to the Cucurbitaceae family, is the fruit of an annual plant. Also known as bitter melon, it actually tastes very bitter. In addition to the antidiabetic effect, hyperlipidemia improvement effect on degenerative knee arthritis are clinically proven. What do you think of this medicinal plant? It's the Momordica charantia. Have you heard of it? It's especially used in eastern countries. It's an edible and medicinal plant. Do any of you take this plant? Some of you will be there too. Traditional medicine name, Gogwa, means bitter fruit. It's an annual plant, so it bears fruit in the fall, so harvest in the fall. We use it as a food or medicine. Its shape is very similar with Lopha cylindrica. The country of origin, India, China, Japan, East Africa, Central America, and South America. The main active ingredient is insulin-like peptide. Charantin is the most important, and cucurbitacin, momordigin, and tridopanoid. These 4 are the main active ingredient. Well, let's talk about the treatment mechanism. First is the action of charantin. A substance known as insulin-like peptide is a kind of saponin. Since it has an action similar to insulin, it has an antidiabetic effect. Second, among the hormones secreted at the end of the small intestine, glucagon-like peptide 1, abbreviated GLP-1, after eating carbohydrate, when the level of glucose in the blood rises, it strongly stimulates insulin secretion. So, this is also used as a drug for diabetes. Bitter melon promotes GLP-1 secretion. It is a very important function. Third, by activating glucose transport receptors, glucose in the blood moves into the cell, so prevent blood sugar from rising. By 2022, a total of 9 randomized controlled clinical studies was reported. In a total of 1,135 patients, capsules or powder made from bitter melon extract, the amount taken per day, 2 grams to 4 grams. The duration of treatment is from 1 to 2 months. As a result of observing the decrease in blood sugar, fasting blood sugar decreased by an average of 14. Postprandial blood sugar also decreased by 26 degrees. HbA1c levels are 0.3 has been reduced compared to patients who took placebo. It has definitely antidiabetic effect. In addition, insulin secretion was increased. However, 2 out of 9 clinical studies, no significant effect reported. If you do an internet search, there are a lot of products, capsules, tablets, powders, tea products, or dried pieces. If you do have decided to take capsules or tablets, go through all the brand description, the most reliable product you can choose. Buy it and read the description carefully. Take as recommended dosage with the smallest amount, start, and observe the reaction. You can increase the dose gradually. And when you get a satisfactory result, just keep that dose. The duration of administration is in most clinical studies, it is more than 3 to 4 months. best to follow expert advice or the product description. If you don't like pills, you can make it into a tea and take it. It's tea therapy. You can choose powdered product by searching the internet. Get powdered product to 250 cc of boiling water. Add 1 to 2 teaspoons of powder. Leave it on about 10 to 15 minutes before or after meals. You can take it like a tea. Dosage per day is usually 2 to 4 grams. You can take it all at once or divide it several times. Morning and evening you can drink. This plan is also edible. Food or drink. It's always starting with a small amount. The recommended amount is 2 to 4 grams. Starting with 2 grams, gradually observing the reaction, you can just increase it. The duration of use is 3 to 4 months or longer. Well, let's talk about traditional decoction method. In order to extract more active ingredient, it's decocted in herbal teapot. You need to buy dry slices first or buy whole fruit. You can also dry it at home and make dry slices. In 1 liter of water, add 6 to 15 grams per day and about 30 minutes just boil it. In the case of the root, it's boiled for about 100 minutes, but bitter melon is fruit, 30 minutes is enough. After 30 minutes, soaked in water, you can take it before or after meals as tea. Because it tastes bitter, according to taste, you may add other things, but it should be sugar-free. What I recommend, cinnamon. Adding a small amount of cinnamon, it smells good and has a sweet taste, so it's very good. In traditional medicine, other than diabetes, using it for diarrhea, toothache, etc. In traditional medicine, a person who are or are planning to be pregnant should avoid. Side effects and treatment, itchy mild allergy symptoms is okay. But if it gets worse, stop taking it immediately. Better to visit the hospital. Second, gastrointestinal symptoms, abdominal pain or diarrhea, flatulence, gas and stomachache. Stop for 2 to 3 days. Then again in small amount. Once you start, there's usually no problem. Third, symptoms of hypoglycemia is a plan with anti-diabetic action. Symptoms of low blood sugar may occur. If you feel dizzy or sweaty, eat something sweet like candy quickly. Anticoagulants or diabetes medications, if you are taking, your doctor needs to know. It would be better if you consult in advance. There are reports of embryo toxicity in animal experiments. Pregnant or lactating women should avoid. In addition to the antidiabetic effect in clinical studies, there are also other proven effects. The first is hyperlipidemia, in particular triglyceride, cholesterol, also known as VLDL. It has been proven to reduce. Second, improving the indicators of metabolic syndrome. Third, pain and symptoms of degenerative osteoarthritis. There are clinical studies showing improvement. Now, the fifth medicinal plant is a plant that grows wild in the tropical desert. It's a perennial plant of the lily family. In addition to the treatment of diabetes, reduce skin wrinkle, increase skin elasticity, etc. Anti-aging effect of skin has been reported. What's this medicinal plant? This is aloe vera. Aloe vera's traditional medicinal name is nohue. It's a plant native to desert areas. It's also cultivated in regions with similar climate. Aloe in Arabic, it means bitter substance. Vera in Latin means true, so it means really bitter plant. There are a few things you should know about this plant. There is a product made from raw materials using the whole leaf. There are also products made from the center of the leaf, that is a gel part. product made from leaf periphery, i.e. just inside the shell, is a latex material. A leaf consists of two parts, gel and latex. Either use these two parts separately or take two parts at once. So, there are three kinds of aloe vera products. At first, talking about the product made from gel part. The characteristics of gel part is the anthraquinone component doesn't exist. Long-term use of anthraquinone has quite a few side effects. Therefore, the gel part has few side effects. It's a safe part. Next, not the gel part, just inside the shell, side called latex. This part is very tasty and contains a lot of anthraquinones, which has a laxative action. So aloe vera, depending on the part, you should know that the active ingredients are different. Let's look at the main active ingredient. Ingredient with anti-diabetic effect. The important one is anthraquinone. Anthraquinone include aloimodine, imodine, and aloin are representative ingredient. Next, among the polysaccharide component, there are S-mannan. It's an important active component, anti-diabetic, cardiovascular protection. The skin protective effect was mainly reported. Belongs to the anthraquinones. These are aloimodine, imodine, aloin. In the case of the polysaccharide S-mannan, it has an anti-diabetic effect, of course, and mainly effective in treating digestive disease is reported. Let's look at the healing mechanism of aloe vera. First, aloimodine. Because of its strong anti-inflammatory action, it works well to protect pancreatic cells. The second polysaccharide component has an inhibitory effect on the signal of pancreatic cell death. Also, these polysaccharides has the action of stimulating insulin secretion. First, in the small intestine, reduce glucose absorption. It causes blood sugar to rise slowly. As a final mechanism, due to its antioxidant and anti-inflammatory properties, inhibiting the progression of diabetic complications. In 2019, a total of 14 control clinical study results have been reported. These study subjects are diabetic patients and pre-diabetic patients were also included, all of the ages of 20. 690 patients. A daily dose as a powder or capsule from 600 mg to 2.8 gram. Fasting blood glucose reduction levels were higher than those in the placebo group. It's definitely reduced. HbA1c levels are about 0.41 to 1.05% has been reduced. Additionally, among diabetic patients with obesity, in a study of 136 people, weight or body fat decreased and improved insulin resistance results has been reported. Also, if you do an internet search, capsule, tablet, powder, tea, etc., there are many products. By the way, aloe vera, unlike other medicinal plants, when choosing a product, be sure there are some things you should pay attention to. If you choose tablets or capsules, gel, that is, the central part of the leaf, is made as a raw material. There are also products, on the other hand, latex, that is, the inner part of the skin, is used as raw material. In addition, some products contains both gel and latex. Product made from whole leaves. Because the pharmacological action is different for each part of a leaf, there are several kinds of product. As it will be explained later in the side effects section, in terms of safety, among the three kinds of product, I recommend choosing a product made of gel. If you decide on a tablet or capsule product, you check that the raw material is gel. After get it, take the recommended dosage. Because it's highly concentrated, you must follow the recommended dosage. You should start with the smallest amount, observe your body reaction, check your blood sugar level regularly, watching for side effects, slow adapting. Fresh leaves themselves can be used. After getting fresh leaves, the gel part in the leaf, you can also take it with a spoon, or you can also drink juice. Buy fresh leaves, not just under the shell. Scoop the central gel part up with a spoon and take it. A typical daily dose is 15 to 30 cc. This method, there are some inconvenience, so juice products buy and use as recommended. In a traditional medical method, dried aloe vera leaf juice, turn it into powder, hold and take it like herbal tea. In 1 liter of water, powder made from dried aloe vera leaf juice, adding 0.5 to 1 gram and boiling for 15 to 30 minutes. You can take it before or after meals as tea. In traditional medicine, in addition to diabetes, constipation, irritable bowel, ulcerative colitis, hepatitis, hemostasis, skincare, arthritis, asthma, chronic fatigue, etc., there's a record of use. As a point of caution, people with loose stools, in case of pregnancy, avoid using it. Side effects and treatment. Generally safe, but recently, when using whole leaves, genotoxicity and the carcinogenicity problem are reported. So, the use of whole leaves, a trend that restrict or prohibit in the European Union, the United States, and Taiwan. If you experience abdominal pain or diarrhea while taking it, it is recommended to stop. Let's talk about electrolyte imbalance and muscle weakness problems. There are many reports when using a product made from whole leaves, when potassium in the blood is low, muscle strength is weakened. In this case, stop taking it. If you are taking cardiotonic or anti-arrhythmic drugs, steroid or diuretics, liquorice, etc., because of the increased risk of hypokalemia, should not be used together with aloe vera. Other side effects are similar with other medicinal plants. If you have allergy symptoms, stop using it. Better to visit the hospital. If you are taking anticoagulant or diabetes medications, it's better to consult with your doctor. If you have symptoms of low blood sugar, eat sweets and deal with it. Gastrointestinal, kidney, and liver function problems, it's better to consult with your doctor in advance. Pregnant or lactating mothers and children under the age of 10 avoid taking it. Let's take a look at another proven effect. The first one is hyperlipidemia. Reduce triglyceride and bad cholesterol, increase good cholesterol. The second is not to take, but gargle, dry mouth, chronic periodontitis in diabetic patient. Tooth decay is getting better. When receiving chemotherapy or radiation therapy, stomatitis or oral mucositis often occurs. Aloe vera gargle solution reported improvement with continued use. Third, if you are diabetic and obese, reducing body weight and body fat is reported. And wound healing effect on the skin disease, psoriasis, genital herpes, chronic skin ulcers, burns, wrinkles or elasticity on the skin, irritable bowel, ulcerative colitis, etc. It has a symptom improvement effect for all these problems. Now, the sixth medicinal plant. Although numerous clinical facts have been demonstrated, a lot of people don't know its value. The world's best-selling is one of the medicinal plants. It's a leaf. In addition to the treatment of diabetes, anti-atherosclerotic effect, cognitive function improvement has been reported. What's this plant? It's a ginkgo leaf. An important thing is, fallen leaves or yellow ginkgo leaves is not used. You must use green leaves or yellowish green leaves. Numerous clinical effects have been demonstrated. It's a valuable medicinal plant, but many people didn't know. It's one of the best-selling herbs in the world. Among the main active ingredients, the most important active substances is the flavonoid and the terpenoid. Specifically, the first is ginkgolide BC, the second is ginkgoghrelin, is gingerin, and the fourth is ginkgotide. These ingredients with ginkgo in front of their names are, broadly speaking, that belong to flavonoid and terpenoids. Let's find out the treatment mechanism. About the insulin receptor, ginkgo enhances expression within the chromosome. When insulin acts, the signal should be well transmitted. Ginkgo suppresses signal interfering substances. Thus, insulin sensitivity increases. Second is, by anti-inflammatory and antioxidant properties, insulin sensitivity is also increased. The third one, glucose in the blood, allows it to move into the cell. First, this is a unique feature. It increases blood flow, creating blood vessels. Diabetic patients have many vascular problems. Ginkgo has an effect of preventing and improving vascular complications. By 2019, controlled clinical trial papers, 7 were reported for 768 diabetic patients. Daily dose is from 16 mg of leaf extract up to 240 mg. The duration of treatment is from 2 months to 18 months. These are long-term studies, a very valuable study, right? Looking at the blood sugar reduction result, the important index for diabetes control, HbA1c, was significantly reduced. Few studies, no improvement in insulin resistance was reported. Next, this paper was published in 2018. Did you hear about metformin? It's one of the most frequent prescribed drugs in diabetes. Recently, this drug is attracting attention for its anti-aging effect. These are patients being treated with metformin in 60 patients with unsatisfactory blood sugar control. Ginkgo extract added 120 mg once daily for 3 months. HbA1c levels were further reduced by 0.9%. A fasting blood sugar reduced level is 40. In addition to diabetes medication, is taken together, this is a report that it works well. In 1998 and 2009, for diabetes complications, there were clinical studies using ginkgo extract for 8 weeks. Diabetic complications of kidney, peripheral nerve, and retina, there are also reports of improvement in complications. This is also an important study result. If you do an internet search, there are a lot of capsules, tablets, powders, teas, etc. If you decide to use tablets or capsules, select a product and get it. You can take it according to the recommended dosage. Among the recommended doses, starting with a small amount and observing the body's reaction while measuring regular blood sugar changes, it should be gradually increased. Try using it for at least 2 weeks. If blood sugar reduction is unsatisfactory, raise the dose a little, observe for 2 more weeks. Those who prefer tea to pills, choose a powder product. To 250 cc of boiling water, add 1 to 2 teaspoons of powder. After 5 to 10 minutes, you can take it like tea. According to taste, lemon juice, or you can also use cinnamon, etc. When adding anything else, there should be no sugar. The duration of treatment varies, but based on clinical studies, it's 1 month more. So once you start taking it for a month, observe it's suitable for you and it works. It means you have to judge. If you like traditional medicine, collect ginkgo green leaves before autumn. You can dry it in the sun. Dried leaves in 1 liter of water. Use 3 to 10 grams per day. Weigh it with an electronic scale. you should always keep the dosage constant. After boiling for 15 minutes, you can take it like tea. With the smallest recommended dose of 3 grams is good to start. In traditional medicine, in addition to diabetes, cardiovascular disease, peripheral blood circulation disease, cerebral infarction, memory problems, cognitive dysfunction, blood vision, tinnitus, hearing loss, dizziness, chronic cough, asthma, diarrhea, etc., there is a record of using. There are no special laws about cautions. Just don't use overdose. Side effects and treatment. Generally, although it is a very safe medicinal plant, overdose or only when taking other drugs that can interact with ginkgo leaves, if you pay attention, that can be safely used. First, reported side effects in clinical studies include temporary headache, dizziness, heartburn in the stomach, digestive problems, nausea, diarrhea, etc. have been reported. Most are temporary and mild symptoms. 2 to 3 days. When the symptoms disappear, then again in small dose. Most of the time, there is no problem. Allergy symptoms are the same as other plants. Third, is something to be aware of. Antiplatelet, anticoagulant, or food or medicinal plants that have antiplatelet action, such as garlic, ginseng, etc., if you are taking, ginkgo biloba itself also has antiplatelet activity. It has anti-atherosclerotic action. Other drugs or medicinal plants with similar effects, if you are taking regularly, a side effect such as bleeding, hematoma reported. The second is gastric ulcer treatment drug, anticonvulsants, antidepressant, anti-anxiety drugs. In case of taking these drugs, taking ginkgo leaf extract together, the metabolism of drugs is stimulated. So, the therapeutic effect of the drug is decreased. So in this case, your doctor needs to know in advance. Other effects besides diabetes, the first is hyperlipidemia and anti-obesity effect. Second, an important feature of ginkgo biloba, inhibiting platelet aggregations, is effective in improving symptoms of peripheral vascular disease. Diabetes and cardiovascular disease, these two are very important diseases. However, ginkgo leaves have an improvement effect on both diseases. Third, cognitive function improvement. There are reports that it seems to delay it, and increase visual acuity, action of macular degeneration changes. Fifth, improvement of symptoms of retinal complication of diabetes are reported. So, if you have diabetes with cardiovascular problems, retinal or visual problems, or if you have memory loss, ginkgo biloba extract is very suitable medicinal plant. Now, the last plant of today's lecture. This is the 7th plant. This plant, it is used more for food than medicine, and it's a perennial plant, it's a tuber. In addition to the therapeutic effect of diabetes, chronic digestive disease, i.e. often after meals, flatulence, stomachache symptoms, or functional dyspepsia. In this case, this plant is enough to enter the top 10. Not only top 10 for diabetes, but also belongs to the top 10 for chronic gastrointestinal disorders. Wow, it's great. It's a tuber that is often used for food. What do you think is this plant? Did you notice? It's ginger. Ginger, wow. It's a perennial plant in the ginger family. Among the main active ingredients, the most important is gingerol. Other than that, these include gingerol, paradol, and shagol. The treatment mechanism. Gingerol suppresses an enzyme that breaks down carbohydrate. Thus, glucose production will decrease. Your blood sugar goes down. Second, the glucose in the blood transporter carrier into the cell is activated, especially into skeletal muscle cells, blood sugar enters the skeletal muscle. Blood sugar goes down. Increase the sensitivity of insulin receptors. The first, with anti-inflammatory and antioxidant action, protect pancreatic beta cells. Looking at the action in the liver, glycogen stored in the liver, ginger inhibits the breakdown of glycogen. Because ginger inhibits the glycogenolysis, you will produce less glucose. Next, activated glycogen synthesis enzymes. Glycogen is made from glucose. Ginger will inhibit using glucose, so glucose goes down, and inhibits several enzymes that involved in glucose production. Due to this combination action, blood sugar reduced. By 2021, 10 papers of control studies were published. 597 diabetic patients aged 45 to 58 years. Daily dose is 1.2 gram to 4 gram. The duration of taking 8 to 13 weeks. As a result, the rate of blood sugar reduction, fasting blood sugar is around 18 to 20. HbA1c levels decreased by 0.57 to 1. Insulin sensitivity is increased. In addition, other studies with gestational diabetes, when taken for 6 weeks, fasting blood sugar was significantly reduced. In another clinical study, in diabetic patients, various inflammation markers were tested. The levels are all reduced. Also, in diabetic patients, several antioxidant index in the blood are improved. If you search the internet, you will easily find capsules, tablets, powders, etc. If you take it as a capsule or tablet product, first select a product. After get it, take the recommended dosage. Most are 1 to 2 gram. However, because each product is different, you should read the recommended dosage carefully. Follow the recommended dosage, start with small amount, observing the body's reaction. By measuring regular blood sugar changes, you can gradually get used to it. Don't you say tea is better than pills? Get ginger powder to 250 cc of boiling water, add 1 to 2 teaspoons. After about 10 minutes, you can take it like a tea. If you like the taste of ginger, you can just take it. If you don't like the smell of ginger, a little bit of cinnamon or lemon juice, etc. is very good. Duration of use, it's good to follow a product recommendation or expert advice. Usually, it's a month more. After a month, you can decide to continue. In traditional medicine, in the fall, harvest ginger or buy it. You can also dry it at home. Or you can purchase dried ginger. Dried ginger slices in 1 liter of mineral water, add 3 to 10 grams. Ginger is the root, so boil about 100 minutes for extracting the active ingredient, and then you can take it like a tea. In traditional medicine, in addition to diabetes, or for respiratory infections, did you drink a lot of ginger tea when you had a cold? Vomiting, diarrhea, back pain, and neuralgia used. As a point of caution, when there is a high fever, it is recommended to avoid. In terms of side effects, the most common thing is heartburn. In addition, if you experience bloating, diarrhea, or abdominal pain, stop taking it for 2 to 3 days. If everything gets better, start again. Allergic symptoms, then stop. If severe, go to the hospital. Ginger has anticoagulant and anti-diabetic effect. If you have a hemorrhagic disease or taking diabetes medications, anticoagulant, antiplatelet medication, consult your doctor. The first biliary tract disease, ginger increases bile production because it works by contracting the gallbladder. Under the right lip, where the gallbladder is located, it can cause pain. Therefore, people with biliary tract disease consult your doctor before taking it. Let's talking about other proven effects of ginger. As I said in the beginning, besides diabetes, ginger is one of the top 10 medicinal plants on functional dyspepsia. Wow, that's awesome! When you eat food, gastric emptying time is reduced by ginger. The second is anti-nausea effect. Representative case is early pregnancy and during chemotherapy. In order to improve this nausea and vomiting, some drug is prescribed such as paradoxin and metoclopramide, etc. However, ginger has almost similar effect with these prescribed drugs. And reduced risk factors related to colorectal cancer. The fourth is its an analgesic effect in dysmenorrhea and muscle pain. Best for pain relief is a pain pills. Ibuprofen and mefenamic acid are frequently prescribed drug. However, ginger has also similar effect. It means that it's a plant with a very great pain relief effect. In metabolic syndrome, slightly lower blood pressure and improved hyperlipidemia. In blood marker test relate to inflammation, reducing the level of inflammation index. It is clear that ginger is a very valuable medicinal plant. If you have diabetes and functional dyspepsia, ginger, this one works for both diseases. It's a really good medicinal plant. Everyone, this is the end of part 2 of the lecture. Really thank you for your hard work. Until next time, see you. Everyone is healthy. See you again next week in class part 3 lecture.